Hello. Today is the first day of Public Service Employee Recognition Week and marks a time when we collectively celebrate the efforts and achievements of our hardworking state employees. The past 12 months have been an incredibly productive time for our department. We've made progress in improving the efficiency and effectiveness of our programs, engaging stakeholders, increasing communication and transparency, and most importantly, achieving real results for the people of Colorado. This has been made possible thanks to all of your hard work. So let's take a minute to recap just a few of your accomplishments. March marked a major milestone for the Food Assistance and Colorado Works programs. They set an all-time record by reaching 97% of applications processed timely. This represents a 14% improvement over a year ago. What's really important is the improved performance means more Coloradans who are hungry can be assured that they will get the assistance they need when they need it most. And that's something we can all be proud of. Another example of the great work of our state employees is the implementation of several lean projects which are streamlining our human resources process. One of the messages I hear consistently as I visit with our staff at our various locations throughout the state is the need to shorten the time to hire for vacant positions. The employees of the Human Resources Division launched a lean initiative to review ways to reduce the time to hire, and in a few months, they have cut the average time to hire in half. Our facilities management team finalized a major project recently. A beautiful state-of-the-art cottage was just opened at our Fort Logan campus, which was a large-scale renovation completed by our staff and several contract partners. The old structure was stripped down to the foundation and completely rebuilt to provide a modern addition to the facilities at the Mental Health Institute at Fort Logan. I also have to mention the huge success of the Disability Determination Services team. The staff at DDS posted a score of 99.2% in initial case accuracy for the first quarter of 2012. This was the second highest score in the nation, and it should be noted that despite the pressures of high caseloads and the push for timeliness, DDS did not sacrifice the quality of their work. We have many outstanding employees within our department, and I'd like to highlight just a few who are making a real difference. The first is Dan Casey, manager in the Division of Child Care. In March, a rule was promulgated by the State Human Services Board that eliminates the use of prone restraints in all facilities licensed by CDHS. The rule was passed in large part because of Dan's leadership and ability to build consensus. The passage of this rule will improve the safety and treatment of the people we and our partners care for throughout the state. Another great employee is Monica Ibarra, the clinical director at our Spring Creek Youth Services Center. In the absence of several employees at the facility, Monica was willing to take on a leadership role and provide the additional support that was needed. She's one of many DYC employees who have gone the extra mile to take on an important revitalization of Spring Creek, which will help to make sure we provide the right services at the right time to the youth in our care. And speaking of going the extra mile, Elise Masters is an administrative assistant in the Office of Performance and Strategic Outcomes. Elise always has a smile on her face and makes work a fun place to be. She went so far as to sew table coverings on her own time for our new CSTAT room. They look terrific. There are dozens of similar stories all across our department, and I'm extremely proud and fortunate to lead an organization with so many talented, innovative, and compassionate individuals. Thank you for all that you do. And do enjoy the special week of appreciation. As always, feel free to contact me with your ideas as to how we can establish Colorado as the most effective 21st century health and human services system in America.